So what are the life support treatment that the medical decision maker can decide on?
The meaning of life support treatment is that it is medical care to try to help you live longer, and one of these include CPR or cardiopulmonary resuscitation. Cardio means heart, pulmonary means lung, resuscitation means to bring back, so cardiopulmonary resuscitation means to bring back the function of the heart and lungs. And this may involve pressing hard on your chest to keep your blood pumping, or using a machine to provide electrical shocks to jumpstart your heart, or providing you medications in your vein.
What is the breathing machine or ventilator?
This is a machine that pumps air into your lungs and breathes for you when you're not able to breathe on your own. And usually when you're on a breathing machine, you're not able to talk because you are intubated, and the process of intubation is when they insert a tube through your mouth and then into your airway. And by doing this, a patient is able to be placed on a ventilator to assist with their breathing.
What about dialysis?
Dialysis, most commonly used in kidney dialysis. This is a machine that's usually used to filter and clean your blood if your kidneys are not working properly.
What is a feeding tube?
This is usually a tube that's used to provide nutrition to you if you're not able to swallow. A tube is usually placed through your nose into your throat and stomach, or it can also be placed by surgery directly into your stomach.
So the medical decision maker also can decide whether or not the person should get IV, like blood and water transfusion. Can you explain a little bit about that?
So for intravenous therapy, also known as an IV, this is a type of therapy where it's commonly used for blood and water transfusions. So fluids and blood is given directly into your vein using a needle or tube.
So what are the choices the medical decision maker can decide on?
So a medical decision maker can also decide on if you're to undergo a surgical procedure and or if you're to take a certain type of medication. This all depends on your doctor's diagnosis and their advice, your own wishes, and the ultimate decision of your medical decision maker. And to undergo surgery and to take certain types of medications, this can vary case by case depending on your own diagnosis and prognosis.
When making our own healthcare choices, any consideration when preparing an advance directive?
There are four main things to consider. These are number one, understanding your own values. Number two, identifying your own beliefs. These can be your personal beliefs, your cultural beliefs, or your religious beliefs. Number three is clarifying your own goals of healthcare in a specific scenario. And number four is choosing your medical decision maker.
How to obtain the form of advance directive, Evelyn?
You're able to access the Advanced Directive form on our website, aamgdoctors.net. Once you get to our homepage, under For Patients, click on Advanced Healthcare Directive. On there, you will see a box that says View Advanced Healthcare Directive, and you can click on that, and it will take you directly to the form. When completing the Advanced Directive form, remember to sign it yourself and have it signed by 2 witnesses, or have the document notarized. Also consider making copies for your medical decision maker, your healthcare provider team, yourself, your family members, and your close friends. If you need step-by-step help in completing the Advanced Healthcare Directive form, in our next video, we go into more details on each individual page of the form. Thank you so much, everyone.